Welcome to our session on Medicaid. My name is Aaliyah McKinley, and I'm the Director of Community Outreach and Education at the Asclepius Initiative. First, I want to welcome you to the Asclepius Initiative. You might be wondering about our name, as it certainly is unique. Asclepius comes from Greek mythology, and it represents medicine and healing. And the goal of the Asclepius Initiative is to raise awareness and promote change to make continuous, high-quality, affordable healthcare coverage a reality for all. Medicaid provides free or low-cost healthcare coverage to qualified people of all ages with low incomes, including children, pregnant women, older people, and people with disabilities. With Medicaid expansion in Kentucky, it is available to adults aged 19 to 64 with incomes up to 138% of the federal poverty level, and to pregnant women with income up to 200% of the federal poverty level. Medicaid covers preventive care, child dental and vision care, doctor visits, prescription drugs, mental health services, and hospital care. The Kentucky Children's Health Insurance Program, K-CHIP, is available for uninsured children under 19, pregnant women, and postpartum women through 12 months following delivery whose family income is too high for Medicaid, but up to 218% of the federal poverty level. K-CHIP covers doctor visits, well visits and immunizations, mental health services, prescription drugs, dental and vision care, and hospital care. Eligibility for Kentucky Medicaid is primarily based on income level relative to the federal poverty level. As of 2026, the eligibility criteria are as follows. Children up to age 1, family income up to 200% of the federal poverty level. Children ages 1 through 18, family income up to 147% of the federal poverty level. Pregnant women and up to 12 months postpartum, family income up to 200% of the federal poverty level. Adults, income up to 138% of the federal poverty level. Elderly, 65 and up, and disabled individuals, subject to both income and asset limits. This chart displays the 2026 federal poverty level guidelines characterized by household size. The Kentucky Children's Health Insurance Program, or K-CHIP, is available for children and pregnant women whose family income is too high for Medicaid, but up to 218% of the federal poverty level. In 2026, there is an annual eligibility check for Medicaid. Your anniversary date is the date your eligibility was first established. Members should receive a letter from the Kentucky Department for Community-Based Services a few months before their Medicaid anniversary, explaining how to verify your eligibility. We'll talk more about this in a minute, but starting in 2027, verification of income will be every 6 months rather than once a year. The Department for Medicaid Services, or DMS, oversees the Medicaid program, including managed care organizations, or MCOs, which process claims and provide prior authorization, disease management, and other services to recipients. Managed care organizations, or MCOs, are contracted by the Department for Medicaid Services, DMS, to provide coverage for most Kentucky Medicaid recipients. Some MCOs offer special programs or value-added benefits to recipients in addition to regular Medicaid benefits to improve overall well-being. Examples of value-added benefits include gift card rewards for certain healthy screenings, well visits, and other healthy activities, tobacco cessation programs, home-delivered meals, diapers, strollers, car seats, and cribs for new moms if needed, transportation benefits, no-cost smartphones with data, talk and text, and telehealth. Some questions to ask when picking an MCO include, Which plan has the preferred providers my family and I visit? Which MCO offers special programs that may be of interest to me and my family? Do any family members or I have health problems that need treatment by a specific type of doctor or specialist? Is the hospital that my family and I prefer on the plan? With managed care plans, you have the right to choose among the plans available in your area. Not all MCOs are available in all areas, and you have the right to change an MCO if you move to another area or if you're not satisfied. Note that some members get confused about whether their plan is part of the Medicaid program or a marketplace plan. It will say this on your card. How to apply for Medicaid or K-CHIP. These are the steps to apply for Medicaid. You'll need your necessary documents listed here. You'll choose your preferred method to submit your application, and the Department for Community-Based Services will review your application to determine eligibility. If you're eligible for Medicaid, you'll be enrolled and directed to choose a managed care organization. After your application is approved, you will receive a welcome packet in the mail. You can apply for Medicaid and K-CHIP online, by phone, or in person with help from a connector, or by mail or fax. Go to connect.ky.gov to get started. There are people who are called marketplace connectors for Connect, and these are authorized health insurance navigators. They can help you with eligibility enrollment forms and applying for Medicaid and qualified health plans. Immigrant status. Coverage for immigrants requires U.S. citizenship or valid eligibility status. Undocumented persons are not eligible for government-funded health insurance programs except on a limited emergency basis. Those with legal status may qualify for Medicaid or K-CHIP, but many are subject to a 5-year waiting period. Households may contain non-applicants who do not need to disclose immigration or citizenship status, but whose income counts towards household income eligibility levels. Qualified immigrant categories include lawful permanent residents, green card holders, for those 19 and older, eligible for Medicaid after 5-year ban, eligible for qualified health plans or QHPs and premium tax credits. For those under 19 and pregnant women, no 5-year ban for Medicaid, eligible for QHPs and premium tax credits. Ban start date is the date that qualified immigrant status is secured. Certain battered non-citizens, their spouses, and children, excluding the abuser, eligible for Medicaid after a 5-year ban with a pending or approved petition with the Department of Homeland Security or DHS. Qualified immigrants exempt from 5-year waiting period. Victims of human trafficking, certain Cuban Haitian entrants, refugees and asylees. Emergency Medicaid. People who don't qualify or are under the 5-year ban may still get limited emergency Medicaid if they meet other requirements. A substantial portion of Kentucky's population is dependent on Medicaid for healthcare coverage. Projected Kentucky impacts of Medicaid cuts and marketplace changes include loss of up to $2.1 billion in federal funding annually. 200,000 to 350,000 Kentuckians could lose coverage due to Medicaid cuts, work requirements, and other regulatory changes. Loss of 12,100 jobs. An additional 47,000 Kentuckians could lose coverage due to changes in rules and marketplace subsidies on Connect. 35 Kentucky hospitals are at risk for closure. Kentucky impacts of Medicaid cuts and marketplace changes include reduction in marketplace open enrollment period, going to 45 days instead of 75. Eligibility verification will be every 6 months instead of every year. Significant increase in paperwork and bureaucratic hurdles for Medicaid and marketplace recipients. Medicaid copay requirements, which will serve as barriers to necessary care. And Medicaid work requirements. What you see on the screen are some key highlights of changes in Medicaid that will be implemented as a result of the 2025 One Big Beautiful Bill Act, or OBBBA. The policy change start times vary between 2026 and 2028 based on the specific rule. The items listed here are in order of effective date, not by their relative importance or by the number of people who will be affected by the individual changes. Because, however, in aggregate, these changes have a significant impact on millions of people, we will go over them one by one in the slides to follow. I want to note that the OBBBA, also known as HR-1, is an extensive bill with many additional regulations, too long and complicated to cover here in its entirety. For those who are interested, I encourage you to read the briefs prepared by KFF, referenced on this slide, or even the original source material. Immigration eligibility changes effective October 1st, 2026. Federal rules are becoming more restrictive, reducing the categories of lawfully present individuals who can qualify for Medicaid. Remaining in are green card holders, also known as lawful permanent residents or LPRs, Cuban Haitian entrants, COFA, citizens of the freely associated nations of the Marshall Islands, Palau, and Micronesia who live in U.S. states or territories. Referring specifically to those who are immigrants, lawfully residing children and pregnant adults in states that offer them coverage. Note that most of these groups are still subject to a 5-year waiting period after their qualified status before they can actually enroll in Medicaid. Those who are out. Starting in late 2026, humanitarian groups, including refugees, asylees, and trafficking survivors, will lose federal eligibility for Medicaid. In addition, there is a long list of those who had conditional entry granted before 1980 who will lose eligibility, such as DACA recipients, people with work visas and other temporary valid visas, and U visa holders and applicants. Kentucky currently uses the ICHEA, or Immigrant Children's Health Improvement Act option, which excludes lawfully present immigrant children and persons who are pregnant from the mandatory 5-year waiting period. While other groups may lose coverage, this specific protection for kids and pregnancy remains Kentucky's state policy for now. 6-month verifications effective December 31st, 2026. The big picture, starting December 31st, 2026, your state must check your eligibility every 6 months rather than once a year, which is twice as often as before, increasing the burden of responsibility for both those who need Medicaid and the states which must administer the program. This adds more barriers to coverage for those who already have many challenges, such as low English literacy, limited digital access or competency, inflexible work hours, or limited transportation options. It creates additional opportunities to lose coverage from missed notifications, deadlines, or processing errors, even if there have been no changes in income or true eligibility. To minimize the chances that you will miss notifications and loss of coverage, it is critical to keep all your contact information, such as your mailing address and phone number, up to date in the Connect system. Because of the more frequent verifications, there are even more opportunities to lose coverage. Starting January 1st, 2027, new federal work rules referred to as Community Engagement Requirement take effect. To enroll or maintain Medicaid coverage, Able-bodied recipients ages 19 through 64 must prove every 6 months that they spend at least 80 hours a month working, volunteering, or in school. While there are mandatory exemptions for caregivers, pregnant or postpartum individuals, and those with certain health conditions, these rules impose significant burdens on recipients and state systems. Another consequence: if you lose Medicaid because you failed to meet the work requirements, you are also prohibited from getting financial discounts on marketplace plans, making affordable coverage that much harder to obtain. What is called the retroactive period is being shortened. This change matters because, say you were uninsured and had a car accident and went to the ER in January, or maybe you were diagnosed with breast cancer while uninsured. Previously, you could apply for Medicaid as much as 90 days after you received care, and if you qualified for Medicaid, the care would be retroactively covered, a process known as retroactive enrollment. Starting January 1st, 2027, the OBBBA reduces the time that Medicaid will pay for the care you received before being accepted into the Medicaid program. As I mentioned, previously this window was 90 days. Under the new rules, Medicaid will only pay for bills dating back 1 month before you applied for those who qualify for Medicaid under the expansion rules, known as expansion enrollees, and 2 months for those who qualified as traditional enrollees, including seniors and the disabled. The takeaway is that you should apply for Medicaid as soon as you are eligible. Don't wait until you discover that you need care. Also, if you are not sure if you're eligible, go ahead and apply. Hospital funding cuts effective January 1st, 2028. These changes most directly affect providers of care. However, decreases in funding are expected to ultimately reduce access to care, not just for Medicaid enrollees, but for everyone who would use these services or providers. For example, if a hospital closes or shuts down its labor and delivery unit, they are gone for everyone in the community, not just those with Medicaid coverage. That is why it matters to all of us. Historically, states have imposed what are called provider taxes on hospitals and nursing homes to obtain matching federal funds. This process brings federal dollars into the state to pay for services without taking money out of the state's general budget. However, the 2025 budget law permanently stops states from creating or raising these taxes, thereby reducing the dollars coming into the states from the federal government. Simplifying things a bit, states could previously charge up to 6% of provider revenues under what's being called the safe harbor amount. This is being reduced by 0.5% per year until it reaches 3.5% in 2032, significantly decreasing the amount of federal funds that states will have available to pay for care for Medicaid recipients. Another source of federal funds for the Medicaid program come from what are known as state-directed payments to hospitals and nursing facilities, although they may affect other types of providers as well. Starting in 2028, these payments will be lowered by 10% each year until they reach 100% of Medicare rates in states that adopted Medicaid expansion and 110% of Medicare rates in non-expansion states. The net impact is that loss of these sources of revenue caused by lowering the provider tax safe harbor and decreasing state-directed payments is likely to cause staff shortages, longer ER wait times, or the refusal of providers to accept Medicaid patients. And again, note that Kentucky has already been identified as the state at risk for the highest number of hospital closures. New copays, effective October 1st, 2028. The OBBBA will newly impose copays for services delivered to what are already low-income recipients, creating yet another barrier to care. These fees apply to adults in Medicaid expansion states who have incomes of 100% to 138% of the federal poverty level. While some types of care will remain free, copay charges of up to $35 will apply to such types of services as specialist visits, x-rays, labs. Medicaid recipients cannot be charged a copay for primary care such as family doctor visits, mental health, pregnancy care, and substance use disorder treatment. Note that there is also a yearly cap on out-of-pocket costs, limited to 5% of total income. Thank you for attending our session on Medicaid. Last step, please take our survey. It helps to show our funder that people are using this material and increases the chances that we will be able to continue to provide useful information on healthcare coverage in the future. If you are interested in staying up to date with the Asclepius Initiative, there's a lot of great information that we share on our monthly newsletter. Feel free to scan this QR code to sign up for that. We don't do anything with your information other than send you a great newsletter every month. You can follow us on the following social media sites. We're on LinkedIn, Facebook, Instagram, Blue Sky, and YouTube. If you need more information, we have you covered. You can go to asclepiusinitiative.org/toolkit or scan this QR code. We have a lot of amazing free resources on our website, and I encourage you to check that out. I want to thank the Kentucky Department for Public Health and their grant that lets us bring this information to you at no charge so that people like you and me can get the resources we need to better understand our healthcare coverage.